This lesson will focus on minimizing radiation dose to personnel. Although the recommended dose limit for us, for the radiographer, is 20 millisievert per year with no more than 50 being exceeded, in my experience it has shown that there is considerably lower exposures than this. That is usually the routine. When I'm looking at your dose reports every 3 months, it shows about 0.02 or 3 millisievert for a 3-month period. In general, we never exceed 1 millisievert within the year. Of course, radiologists or doctors or nurses that are working right beside the patient in fluoroscopy, let's say, or in the operating room, they may have higher doses as a result of the type of work that they are doing. So clearly, there's no major concerns for you guys in terms of exposure, but we do need to explain the general requirements to minimize dose to ourselves. You need to know in general how a dose can be reduced when working with the radiologist in the fluoro room or the nurse or in the operating room. You have to think of different situations that you may be working in. We need to summarize basic principles of radiation protection, explain the inverse square law as it applies to us, describe how the dose reduction methods and techniques can be used to minimize our dose. We'll be looking at recommended safety management procedures, characteristics of personal radiation monitoring, correct placement of the TLD, and we will be interpreting a personal radiation monitoring dose report. So how do you go about decreasing the radiation exposure to yourself? We know that in fulfilling our responsibilities or our duties in diagnostic imaging, that we are exposed to secondary radiation. Some X-ray procedures increase your risk to the exposure, and when participating in any procedure that may result in occupational exposure, you must employ the appropriate methods of protection against that ionizing radiation. To achieve optimal safety, responsible users, and that's us, must make every reasonable effort to keep exposures to ourselves and other personnel far below the limits that are specified. General requirements and recommendations, as stated in the Safety Code 35, says that the X-ray room should never be used for more than one person or examination at a time. Only those people that need to be in the room should be in the room, so the patient and no one else. And the radiographer will be standing behind the lead barrier and exposing. Personnel must at all times keep as far away from the X-ray beam as possible. So remember time, distance, and shielding, distance being the focus in this point here. Direct radiation exposure by the primary beam must never be allowed, so don't put yourself in harm's way. Don't hold the patient unless it's absolutely necessary. In most instances, you could get an assistant or a nurse to help because they're not involved in taking radiation exposures on a daily basis. It should never be you holding the patient or being in the room when the exposure is taking place. All personnel must be using available protective devices when possible. So if you do need to be in the room for whatever reason, make sure that you are protecting yourself with a lead apron. As a medical radiation technologist, you must have access to a personal dosimeter, whether that be an electronic personal dosimeter or a TLD. This must be worn and it must be stored according to the recommendations of the service provider or of the facility or hospital you are working for. When a protective apron is worn, the personal dosimeter must be worn underneath the apron. And if extremities are likely to be exposed to significantly high doses, let's say you're in the operating room for a really long time, or you're in the fluoroscopy room, or you're doing an interventional case, you can have an additional dosimeter which should be worn at those locations on the body, extremity locations, or there could be an additional dosimeter at the collar level to monitor your thyroid gland or your eyes. And by law, all dosimetry records must be maintained for the lifetime of the facility. So if you are working at Hamad Hospital for the next 20 years, you should easily be able to access those records of TLD readings for the time period that you were working there. A female X-ray technologist should immediately notify her employer upon knowledge that she's pregnant. And this has to be done in order to ensure that her work duties for the remainder of the time that she's working there is limited to a certain recommended dose. In most instances, it may not be necessary to remove the pregnant staff member from her duties. It is recommended that the decision to remove pregnant workers from their duties are considered based on the area that they're working in. The radiation exposure risk can be calculated by the medical physicist or the radiation safety officer to determine whether she should continue working in the area she's working in or whether the work should be distributed. We'll revisit the pregnant worker again in a few minutes, but I'll continue on here. Also, there is a recommendation that when there is a need to support a weak patient or to support a child, a holding device should be used rather than you holding the patient. If parents or escorts or other personnel are able to assist, they should be assisting and they should be provided with the protective gear, the protective apron and the gloves if needed. No person should regularly be performing a duty of holding the patient. This should be spread out, of course, because the less time you spend with the source of radiation, the less chance of those stochastic effects occurring. All entrance doors to the X-ray room should always be kept closed while the patient is in the room. You don't want any scatter radiation leaking outside the room and affecting anybody walking by. X-ray machines, which are energized and ready to produce radiation, must not be left unattended. You don't want someone walking in and pressing a button and accidentally exposing someone. It is your responsibility as a technologist to become familiar with the IAEA Basic Safety Standards that provides the guidelines for justification, optimization, and dose limitation. The optimization starts at the X-ray room planning, design, and construction stage, ensuring that doses are kept low by applying a protective barrier between yourself and the patient, like a control booth and lead-lined walls and doors, all of which can keep the dose as low as possible to yourself. During your normal working day, you should do your best always to ensure that exposures are restricted by application of the dose limitation system, making sure that the examination is justified, that when you're reading that requisition and checking the patient history, that there is a correlation and you're not taking unnecessary exposure, because every extra exposure you take is an extra exposure to yourself, because your dose is mainly coming from the scatter radiation, which comes from the patient. Ultimately, exposures that have not been justified leads to unnecessary radiation to yourself. No matter the type of system used, optimization of image quality at an acceptable dose to the patient should be a priority, as this in turn will also reduce your dose. Also ensure that you know and understand the exposure limits for radiation workers and for students. Remember, dose limits for technologists apply only to the irradiation resulting directly from your work and does not include radiation exposure from other sources, such as medical diagnosis or background radiation, or radiation in the food you may eat, and so forth. If you recall from a prior lesson, for technologists in training and students, the recommended dose limits for members of the public should apply, and for radiation workers, once again, an annual dose limit of 20 millisieverts should apply. At the end of the day, the radiographer is allowed to absorb more radiation than the general public, but just because they're allowed to do so, because of the nature of their work, doesn't mean that they should be exposed to more radiation, because it can be minimized. Medical research and educational facilities such as CNAQ will have a radiation safety manual, and in this manual you'll find guidelines and responsibilities of those professionals or technologists working with the radiation equipment. In the manual, it will outline best practices and procedures to follow to keep those doses as low as is reasonably achievable and to minimize the dose to those working with the equipment. Now, in many hospitals, like Hamid Hospital, you will have a list of policies and procedures. And these policies and procedures, similar to the radiation safety manual at the college, will identify what is required or needed to keep those doses as low as possible to not only the technologists, but to the patients as well. So the policies that are in place are normally things like policies regarding holding patients, who should hold patients and who should not, policies for the presence of individuals in the room. Only the essential personnel should be in the room, the patient should be in the room, and we should not be. We should not be holding the patients. Other policies would include things like personal dosimetry, TLDs, how long they should be worn, and the location of the TLD badge, what is appropriate in terms of where it should be placed on the body. There will be regulations regarding training of operators and how often this should be done. Usually it's every 3 years you have to acquire a radiation protection certificate. These policies and procedures create radiation protection awareness and a degree of safety from most radiation exposures. Although we know that the risk to ourselves is quite low, we have to consciously employ all appropriate radiation control procedures. Evaluation of dose is an important aspect of radiation protection. Personal monitoring ensures that the occupational limits are kept well below the annual effective dose. So that is considering the type of radiation you are exposed to as well. So where should this TLD be positioned? Most of you have been out to clinical already and you know exactly where it should be placed, but as a reminder, it should always be between the neck and the waist, and it should be facing forward. So when wearing a lead apron, you can double up your dosimetry. That's provided that you have 2 dose meters. If you have 2, one goes underneath the apron and one goes on top at the collar or at the neck. The dosimeter above the apron, that's at the collar, will estimate the dose to the thyroid and the eyes, or the lens of the eyes. It is also important that workers return their TLDs on time for processing. Delays in the evaluation of the dosimeter can sometimes result in the loss of stored information. There are several devices that can be used to monitor the radiation exposure to an individual. There are optical simulated luminance dosimeters, there are foam badges, there are pocket ionization chambers, there are extremity or ring finger dosimeters, and there are thermoluminescent dosimeters. Now, the one that I am focusing on here are the TLDs, simply because we use it on a regular basis in Qatar, in the clinics, and at Hamad Hospital when you're working there. So that's why that's the only one I'm mentioning. But if you'd like to read a little bit more about this, you can go to chapter 5 of the textbook. Now, there are advantages and disadvantages to using a TLD badge, which you need to be familiar with. Some advantages is that it is not affected by humidity, pressure, or normal temperature changes. But we know that temperature changes here in Qatar are not within normal, right? It goes from a cool temperature to about 50 or 60 degrees. So if you accidentally leave that TLD badge on the dashboard of your vehicle, you forget to take it into the clinic and you come out at the end of the day and it's still lying on your dashboard, most likely you're not going to get a reading from that. It would null the reading of anything that you acquired prior to that time. It is also mentioned that the TLD badge can be worn up to 3 months. After that time period, there may be a loss in stored information, so that's why it's important to hand it in on time. Another advantage is that the TLD crystals can be reused, which makes it somewhat cost effective. The disadvantages, on the other hand, is that readings may be lost if it's not carefully recorded or if it's not calibrated regularly. At this point, I'd like you to take a 10-minute break before we continue on and revisit regulations regarding pregnant personnel.